Hello everyone, welcome to part 1 of anatomy series, in which we are going to target the bones of the upper limb. To start with, let's look into the anatomy of clavicle. So clavicle in Latin means a small key, and it is the only long bone that lies horizontally. It has no medullary cavity, and it is the first bone to ossify. The only bone with two primary centers of ossification, and the only bone which ossifies in membrane, that is in 5th to 6th intrauterine life. And it completes its ossification at 45th day. The functions of clavicle: it transmits weight of upper limb to the axial skeleton, so it holds the upper limb, and it supports the shoulder and helps in mobility of the arm. Now, for the side determination, in short, the lateral end is flat, the medial end is large and quadrilateral, and the shaft is curved. About the shaft we will see in detail. And inferiorly, it's grooved longitudinally in middle 1/3. So let's quickly look into the features. Right in front of us we have the right clavicle, and a clavicle is divisible into two parts. The first one is the lateral 1/3, and the second part is the medial 2/3. So the lateral 1/3, by default this is the lateral side, and this is the medial side. In the lateral side, we have the acromial end, now the acromial end articulates with the acromial process of the scapula to form acromial clavicular joint, and this is our medial end. So the medial end is also called the sternal end. This articulates with the clavicular notch of the manubrium sterni to form sternoclavicular joint. Now this sternoclavicular joint, it extends inferiorly to articulate with the first costal cartilage. In the shaft, laterally, we have two elevations. One is a tubercle and one is the ridge. The tubercle is called the conoid tubercle. And the ridge is called the trapezoid ridge. Now what these two do is together they form the conoid and the trapezoid parts of the coracoclavicular ligament. Now, the function of the coracoclavicular ligament is it transmits weight of upper limb to the axial skeleton. Also, in the shaft, we have a groove called the subclavian groove. Quickly, we will see the features. So the features are divided into three parts: the lateral end, the medial end, and the shaft. And the lateral end, it's also called the acromial end, that articulates with the acromial process of the scapula. And then the shaft is divided into two parts: the lateral 1/3 and the medial 2/3. The lateral 1/3 has two borders. Anteriorly, it is concave, and posteriorly, it is convex. What I mean by anteriorly it is concave and posteriorly it is convex, considering this is our, just come into this diagram. So this is the lateral portion. So laterally, this is anteriorly, it is concave, and posteriorly, it is convex. And it has two surfaces. The superior part is subcutaneous, and inferiorly, we have the two tubercles. We have the trapezoid ridge, and we have the conoid tubercle. Both together form the coracoclavicular ligament. Now, in the medial 2/3, we have four surfaces. Anteriorly, it is convex. So it is convex anteriorly. And posteriorly, it is a smooth border. Superiorly, it is rough medially. And inferiorly, there is a rough oval impression, about which we will see again. There is a rough oval impression inferiorly. As we can see here, there's a rough oval impression. And laterally, we have the subclavian groove in the shaft. On the medial, as mentioned, we had the subclavian groove here. And the nutrient foramen. Now, the medial end is also called the sternal end, which articulates with the clavicular notch of the manubrium sterni. So let's quickly look into attachments. The blue one here is the insertion, and the red one will be our origin, and the green indicates the ligaments. So for the blue one, let's start with top. Remember, T is trapezius. Okay, not to forget, this is our lateral end, and this is our medial end. So laterally, we have the shoulder. One of the main muscles of the shoulder is the deltoid muscle. So one above, one below, laterally, we have the deltoid muscle. And medially, one above, one below, we have the pectoralis major. Okay? Now, one above and one below, both start same sterno. One is sternocleidomastoid, and one is sternohyoid. So one is sternocleidomastoid and one is sternohyoid. So that's all. Here we had the subclavian groove. So here we have the subclavian muscle. Okay, let's look into the ligaments. Medially, the oval impression that we spoke about earlier. So this oval impression is costoclavicular ligament. Costoclavicular ligament. And here we had two elevations, if you remember. One is the trapezoid ridge, and one is the conoid tubercle. Both together form the trapezoid and the conoid parts of coracoclavicular ligament. The function, as we mentioned, is nothing but it transmits weight of the upper limb to the axial skeleton. A note to mention, the subclavian muscle, the vessels, and the cord of brachial plexus pass towards the axilla between the inferior surface of the clavicle and upper surface of the first rib. The subclavian muscle here acts as a cushion. Let's quickly look into ossification. So clavicle is the first bone to ossify in the body, and it is the only long bone that has two primary centers. So the two primary centers of ossification. And these appear at 5th to 6th weeks of intrauterine life, and they complete at about 45th day. Now, the secondary center for the medial end, we have a secondary center at the medial end. This appears at 15 to 17 years and fuses with the shaft during 21 to 22 years. So most of you, if you are between the age of 15 to 20 years, you're probably having a secondary center of ossification that's going on. Occasionally, there is a secondary center at the lateral end. That is the acromial end. Now, lastly, let's look into the clinical anatomy. The first one is definitely the fracture of the clavicle. The fracture of the clavicle is caused by fall on outstretched hand, and the site of fracture is in the junction between the two curves. So if you can see the junction between the two curves, there is a fracture. Now, why is this fracture happening? Is because there is the weight of the upper limb that pulls the lateral fragment downwards. So one is a fracture of the clavicle. The second one is a congenital condition known as cleidocranial dysostosis. In this, the clavicle is either absent or imperfectly developed. The clinical presentation is by drooped shoulders and approximated shoulders in front of the chest. As seen here, either the clavicle is completely absent or it is imperfectly developed, and you can see a drooped shoulders and approximated shoulders. So that's all for the clavicle, and let's meet in our following videos in which we're going to discuss about the other bones.